Hello, my name is Ashley Mitchell. I am a registered nurse and perinatal nurse educator and safety officer at Exeter Hospital on the Family Center. I am also a MSN student at Colby Sawyer College, and this is my final project for theoretical basis of teaching and learning in nursing education, and it is titled FC Strip Club. Okay, so you might be thinking, what in the world is the FC Strip Club? Well, it is a down and dirty review of fetal heart rate tracings. And this is done in a collaborative manner to help the team on the labor and delivery unit that I work on, the Family Center, be able to really improve their confidence in interpretation of fetal heart rate tracings, help effectively communicate using standardized terminology, and collaborate to improve safety outcomes for birthing people on our unit and their babies. And really, the goal here too is understanding the physiology behind the fetal heart rate tracings and really understanding what to do next, because this is really our bread and butter in labor and delivery, is monitoring these tracings and responding. So it's essential that among our team we have a shared mental model. So why are we doing this? Again, is to improve recognition and response to abnormal fetal heart rate tracings so we can improve outcomes, create that shared mental model so we're all speaking the same language. And it's known that 80% of adverse medical events are due to failures in communication and teamwork. And really, the Strip Club is a way that we can help to really empower our providers and our team to be able to speak up and to work together effectively, all with the same goal of providing the best care possible to our families. So how are we going to do this? Well, this will be done using group discussion, and we will interpret and collaborate together in this engaging discussion type of way. And we're going to review real cases that have happened on the unit, so that this is really problem-centered and realistic to the things that we do in our everyday jobs. So when and where will this take place? Well, this is going to happen in our Family Center conference room, or from the comfort of everyone's own homes, really, using our team's virtual link. And we are going to offer this program quarterly, and the first one will be on February 21st, and then we'll have one in May, August, and then November. And this is going to be offered at lunchtime, because this is a time that our providers would be able to attend and join us, and we really want this to be multidisciplinary. And, you know, for people logging in at home, it's just a nice time as well. And again, who is this going to involve? Well, it's going to involve any of the Family Center nurses. We're going to ask that our certified nurse midwives, family practice doctors, and our OBGYNs also attend. And of course, any student nurses that are working on our unit will be welcome to come. The FC Strip Club will incorporate the 4 ethical principles of autonomy, beneficence, non-maleficence, and justice for the course participants. And these principles will also be integrated into the course content. We know that ethics is the foundation of the nursing profession, and nurses are called to do what is right and to intentionally make a difference for those that they care for. Many times, though, we are faced with ethical dilemmas and we are not really able to find the right thing to do. And that's why the American Nurses Association has written the Nurses Code of Ethics to really help us understand and stay committed to our core values as nurses of respecting human rights, dignity, advocacy, and self-determination for our patients. So nurse educators are held to these same values when interacting with the nursing team, and it's our job to really empower nurses to articulate their values and preferences, respect their differences, and really to instill within them the nurses' code of ethics. And we can do this by acting as role models, knowing that we have a tremendous influence on the team, and therefore we really need to embrace these principles. From a legal standpoint, the FC Strip Club will focus on the importance of informed consent, patient education, shared decision making, the initiation of the chain of command, and proper documentation. The Patient Bill of Rights will be examined throughout the course and will really explore ethical dilemmas that could come up in our practice. For example, when a patient refuses a recommended treatment. And as a team, we'll identify opportunities for patient education and clarification. And really, the Bill of Rights is there to protect the patient, and the nursing team should really understand this and respect it. And patient education is central to the culture of nursing as well to legal practice. That's what Bastable has written in our text. And to me, this really reinforces the why, what, and how nurse educators teach their students, because this will translate into the way they interact with and educate their patients. By understanding that patients have the right to say no to any recommended treatment or intervention, even though we believe it is the best plan of care as a team, is an important component of the legal aspect. We also, as nurses, need to be able to recognize when something moves outside of our scope, and really move up the chain of command to get the provider to review the risk, benefits, and alternative to proposed treatments. And the nurse educator is challenged, again, with making sure nurses know their scope and that they're confident with when to advocate to the provider. In addition, we really need to empower the nurses to feel confident. And in doing this, we need to provide a psychologically safe environment to develop a climate of trust among the team. That means that if anybody feels uncomfortable in a situation, that anybody can speak up. And that could be a nurse to a provider, because fetal monitoring is an area that's highly litigated. And providing the FC Strip Club continued education course, we're really helping to ensure that the team has the most evidence-based care and is really up to date, so they can provide the safest care possible. And then with economics, this course is developed with an appreciation for economic impact. And we really want to make sure this course is attainable to the team. So it is free to family center nurses and providers. And there will be a potential cost savings that will occur just due to the implementation of change in practice, because there will be a decrease in potential adverse outcomes in both the birthing person and the baby. So that could be shown in a cost-benefit analysis. The CEU credits, they'll receive 1.5 credits for participating, and the cost of that is very minimal. And again, just where this is an area that litigation can be high in obstetrics related to fetal monitoring and management of tracings, this is a really small investment to really help the healthcare team improve education and knowledge recognition, so that we can avoid these adverse outcomes. It will likely also increase patient satisfaction scores, and will also have a decrease in neonatal intensive care needs or transfer to tertiary care center requirements. And then there are other hidden benefits as well that we might not be able to measure right away, but could have a tremendous impact on maternal mental health. Just from avoiding traumatic birth experiences, you can avoid depression or anxiety in the birthing person. So nurse educators, always have fantastic and inspiring ideas, but we also need to keep in mind that we need to keep the classes more towards like a dollar store budget. So that has been a challenge for sure for me, but I say challenge accepted. theoretical nursing framework the FC Strip Club will be primarily based upon is Martha Rogers' Science of Unitary Human Beings. Rogers' philosophy recognizes that nursing is both an art and a science, values scientific evidence, and believes in the nurse's capability to creatively support the wholeness of each person. It's a person-centered approach rooted in the idea that each learner has intrinsic value and that building connections among the team can help to promote and enhance relationships to support each individual to function at their highest potential. The next theoretical framework I'd like to incorporate is Watson's philosophy and science of caring, in which Watson refers to the human being as a valued person in and of him or herself to be cared for, respected, nurtured, understood, and assisted. Really instilling the philosophy of caring has the potential to create a ripple effect that starts with the nursing team in this course and will eventually reach the patients that we care for. And then Kurt Lewin's change theory focuses on unfreezing, change, and refreezing, which is an approach to kind of retrain how something was previously learned and adopt a new way of thinking. So this might be helpful in just thinking about how learners might adapt their nursing practice after interpreting fetal heart rate tracings. So really we want to have our learners change their practice, make it their new standard, which really helps impact the psychomotor domain as well at the bedside. So really we want to inspire the team to embrace the new knowledge and incorporate it at the bedside. So in considering determinants of learning, it's important to remember that each learner is unique. It's key to keep the learner at the center of our focus in how we develop, deliver, and assess our nursing education. And that's really the best way to make sure that it's lasting, meaningful, and has impact on their nursing practice. And this really requires the nurse educator to constantly assess and reassess the learner's needs. We need to know what motivates them. In this case, maybe it's earning CEUs, or really it's just the love for learning and providing safe care for their patients. And, learning in a fun environment also adds to the motivating factors here. The adult learning theory is appropriate to keep in mind for this group because it's going to help support the autonomy of each learner and help keep the focus on the material to be relevant, practical, problem-centered, and elicit a sharing of personal experiences among the group. In providing education to professional nurses on my unit, I must consider their developmental stages, and this will primarily include adulthood, early adulthood, and middle-aged adult learners. And knowing what barriers this group might face will be helpful in trying to create a positive learning environment. And the biggest barrier is likely time. It's a challenge to just think about the work-life balance and all the demands on their personal lives, and that can be a barrier to coming in for additional learning. They might not have the extra time to come in, they might not have childcare, they have other things to take care of, competing demands. And then nurses who are working on the floor during the course may not be able to attend if the unit census is high. Just as you would consider personal history, cultural preferences, religious beliefs, and pronouns when caring for a patient, these characteristics should also be embraced in the way of the learner. So equity is the absence of unfair, avoidable differences among groups of people. This can be based upon things like socioeconomics, race, sex, disability, sexual orientation, chronic illnesses, and even things like religion, body weight, and substance use disorders. So equity is attained in healthcare and in education when everyone has a chance to reach their full potential. In order to support and empower learners, we must approach teaching with the moral ideal that each individual has their own unique story, lived experiences, and differences in access to resources which could potentially have negative impact on their learning potential. Respectful teamwork, collaboration, and communication will be known expectations for every person taking the FC Strip Club course. And I will demonstrate these inclusive, respectful, caring behaviors by the use of role modeling. And nurse educators must be aware of their own biases and how those can influence the success and well-being of their students. So the way in which we provide the education, the words that we use, the way that we grade, it has the potential to impact treatment for different students. And we want to be able to maintain equity in education. So just as we learned in this course, one size does not fit all. We need to ensure that the learning environment is welcoming and fair to all, regardless of differences. And this view really encompasses the humanistic learning theory, Rogers' nursing theory, the science of unitary human being, which really values the ideals of person-centered care and respecting the wholeness of a person. Developing a curriculum for the FC Strip Club has required a strategic, well thought out approach in order to best support the learner in gaining knowledge, development of skills, and altering attitudes and behaviors to achieve the desired outcome. So the purpose of this course is to really improve outcomes for birthing people and their babies when giving birth in the hospital. And the goal of the course is centered on the empowerment of the learner, really looking to improve the team's confidence in interpretation of fetal heart rate tracings, effectively communicating and using standardized terminology to collaborate in order to achieve the purpose of the course, to improve outcomes for birthing people and their babies. So when considering the course objectives, I appreciated this quote from our text from Bastable. If they don't know where they're going, how will they know if they've arrived? So using Bloom's taxonomy, I was able to develop these objectives to be action-driven and really help describe precisely what the learner will be able to do upon course completion. And in order to achieve this, I will be incorporating the use of multiple teaching strategies, but team-based learning is really kind of the approach to help support the development and collaboration among the team. The course curriculum will be sequenced by presenting a review of fetal monitoring terminology, then moving into more maternal fetal physiology, and finishing with the more difficult task of reviewing and interpreting fetal heart rate tracings and coming up with corrective measures. So the first FC Strip Club will be focused on uterine activity and tachysystole. So the first objective of the course will be to, after attending the FC Strip Club, participants will be able to accurately interpret fetal heart rate tracings using NICHD terminology. And like I said, we're going to review the definitions, we're going to discuss the classification of categories, and then systematically describe fetal heart rate tracings that are presented. We're going to do this by a little bit of presentation through lecture, mostly group discussion. We're going to have a fun game, which is going to be called Pole Dance Trivia, and we're going to do 2 practice tracings together. And let's see the next objective. The next course objective is participants will be able to describe appropriate clinical interventions related to maternal fetal physiology in order to optimize fetal oxygenation based upon the interpretation of the tracing. So we are going to do this by discussing maternal fetal physiologic mechanisms, reviewing corrective measures and rationale for what we choose to do. We're going to identify components of the fetal heart rate tracing that indicate normal oxygenation or indeterminate fetal acid-base status, and also discuss the research article that was assigned as pre-work and how that relates to the topic that we're discussing. I'm going to do this by using a short video to really illustrate the mechanism of the effect of contractions and how it affects the fetus and oxygenation status. We will review our hospital tachysystole algorithm and the Pitocin policy that we have. And we're going to use the article again to as a foundation of what we're discussing. Objective of the course, the team will be able to demonstrate collaborative communication, teamwork, and mutual respect after completing this course. So this will be done through group discussion and really embracing shared decision making related to the plan of care. So in order to do this, we will kind of review what the expected behaviors are and support this through team building activities. And this will be pretty short in the beginning of the course, just reviewing what is expected, and then enhanced and incorporated throughout the entire course by supporting group discussion and collaboration. In selecting instructional materials to enhance the teaching plan, the nurse educator must determine what they're trying to accomplish and what the intended message is. And the content of the material really needs to match the topic in order to complement and strengthen the learner's understanding. So for the FC Strip Club, the first topic of our first course is uterine activity. And I really like the pyramid of retention model that we learned about, which illustrates the relationship between the information that is retained and the level of participation among the learners. So it basically says that you will retain 10% of what you read, 20% of what you hear, 30% of what you see. You'll retain 50% of what you see and hear, 70% of what you say and write, and 90% of what you say or do. So with appreciation for this model, I was really trying to be cognizant about incorporating various learning methods and instructional materials into this teaching plan to really optimize the learning process and empower the learner to reach their highest potential. So the first thing I did was incorporate an evidence-based research article related to the content of uterine activity, in which the participants will be asked to read before they come to the course. And the next thing is the course presentation or the course PowerPoint. So that's going to be the medium for the presentation, and this will allow for synchronous virtual learning with the team that is learning from home to be involved with the group at the in-person course. And we are going to use this to really help discuss and look at elements of the fetal heart rate tracing and see it on the screen as well as discuss it in person. And then the fetal heart rate tracing, I'm going to have a physical paper copy of the case that we're looking at, but I will also display this on as part of the PowerPoint presentation so that the team at home can still visualize, review, and interpret it with the group. But they can see, they can hold and touch, and we're going to really pinpoint and hone in on different aspects of the tracing, relating it back to our discussion and also back to the fetal heart rate terminology, really to reinforce the seeing and hearing elements. And then we're really going to discuss what should we do about it and how we can intervene to correct the tracing to really optimize fetal oxygenation. Also going to incorporate a short video, which is going to reinforce the concepts of maternal fetal physiology and the mechanism of contractions on fetal oxygenation. And this will just be another way to engage the learners in a visual aspect. The evaluation is the process of judging the worth or value of a program, and it provides evidence that the program makes a value-added difference for the unit. So the overall mission of the FC Strip Club is to improve recognition and response of abnormal fetal heart rate tracings in order to optimize outcomes for birthing people and their babies. So, by accomplishing this, there will be a decrease in healthcare costs associated with adverse outcomes, like emergent C-sections and NICU stays, length of hospital stay, and even more long-term outlook on protection of the family in terms of a decreased trauma impact, which heavily influences emotional well-being as well. So, this is a time in labor and delivery where our care can really have a huge impact on the entire life of our patients. And we really have the opportunity to provide respectful, compassionate, evidence-based care to really empower and protect the person and their families. So if we do a good job at that, this program will be worth it. So, we're doing this program because it is evidence-based. We're doing it for a reason. We want to be able to understand the physiological mechanisms of maternal and fetal circulation and how to implement the best corrective measures according to what is identified. And in order to measure this in our evaluation, we want to make sure that we're being clear, specific, and realistic with what we're looking to measure. With a cognitive evaluation, our cognitive knowledge and growth can be tested, and we can do this with a post-test evaluation. And this will really let us know were the objectives that we had in mind met based on the teaching that was done in the program. In an outcome evaluation, this looks at a more long-term change, and this is going to be something that persists after the program has taken place. And ideally, we really want to impact this long-term freezing, if you will, for Lewin's theory. We want to be able to see that there's been a change in behavior and values and attitudes, that really we're collaborating well as a team, and that we are problem solving and keeping our birthing people safe. So this is something that we would do in measuring behaviors and values like 3 months out, 6 months out, and even a year out to see if it's had a lasting impact on our goals. And then the impact evaluation, is this program worth the cost for our unit to have? Does this program help keep our nurses, with nurse retention? Does it help decrease nurse burnout? Does it really empower our nurses and instill and inspire them to really do the best that they can to care for our patients and keep them safe? So, in summary, the overall mission of the FC Strip Club is to improve outcomes and protect the wholeness of our birthing patients and their babies. And we're going to do this by incorporating multiple creative teaching methods that are really matched to the Family Center team's needs, and addressing different barriers that could come up to really support them as learners. And we're also going to build each learner's confidence in recognition and response to abnormal fetal heart rate tracings, and really help them understand the correct interventions to correspond with the physiological mechanisms that would be happening. So to give them a deep understanding of really what's going on and why they need to intervene. And then really, lastly, to improve teamwork and collaboration. That is really at the center of this program. And lastly, the framework of the FC Strip Club is really based upon Rogers' theory, the science of unitary human beings. Again, recognizing nursing is both an art and a science, valuing evidence-based practice and believing in the nurse's capability to support the wholeness of each person. Really valuing each person, and that goes along into Watson's theory of caring, in which each person is viewed as a valuable human being that should be cared for, respected, understood, and assisted. We're going to do this for our birthing patients, and as a nurse educator, I want to incorporate this into how the learners are treated in the program and how we treat each other. And lastly, with Lewin's change theory, we really want to adapt our practice to adopt new ways of thinking, to really collaborate and communicate together, to have a shared mental model to really help protect our patients.